Hello, good morning, welcome. My name is Mary Leonard. I'm the chair of the Department of Pediatrics and the director of the Maternal and Child Health Research Institute. It is my great pleasure to welcome you to the third annual Maternal and Child Health Research Institute Symposium. MCHRI's mission is to mobilize Stanford discoveries and expertise to advance maternal and child health. We also have a very deep commitment to supporting the next generation of maternal and child health investigators. We have an exciting program today that highlights just some of the remarkable maternal and child health research accomplishments of our distinguished faculty across many departments, as well as our early career investigators and trainees. Before we begin, I would like to extend my profound thanks and gratitude to Tony Oro for his vision in creating this symposium and to the entire scientific program committee, including Natalia Gomez-Ospina, Venkatesh Krishnan, Melissa Mavers, Michelle Manji, Trung Pham, Tom Robinson, Manpreet Singh, Virginia Nguyen, and Fan Yang. We also all owe a debt of gratitude to the Maternal and Child Health Research Institute staff, especially Roxana Van Norman, who created the website and is the mastermind behind this entire day, as well as Mary Chen, Grant Wells, Kimberly Stern, Rachel Panizzo, Griselle Rue, and Carol Schultz. It is now my great pleasure to welcome Lloyd Minor, the Dean of the School of Medicine. Under Dean Minor's leadership, Stanford Medicine has established a strategic vision to lead the biomedical revolution in precision health. As investigators and clinicians in maternal and child health, we could not embrace this vision more strongly, as we know that events during early development have a profound impact on one's health over the entire life course. And it's really the pediatricians, we believe, who are at the forefront of prevention and prediction. Welcome, Dean Minor.
Well, thank you very much, Mary. It's great to be here, and thank you for your leadership of the MCHRI. I completely agree with you. It's childhood and even before birth that the determinants of health are very importantly set. I also, at the outset of this symposium, want to take this opportunity to thank Paul King, President and CEO of Lucille Packard Children's Hospital and Stanford Children's Health. We have so appreciated Paul's extraordinary leadership before and during this pandemic. And thank you to each of you who have joined us today in this new virtual world that we're all living in. And I, like Mary, want to thank Tony Oro and the team that thought of a very creative approach to this symposium. You'll notice that there are now virtual poster sessions and ways to interact that we hadn't necessarily considered possible before we all found ourselves in this virtual Zoom world that we're living in. As Mary said, so many of the determinants of health are set before birth and during childhood. Certainly one of the things that's been emphasized and become very apparent during COVID, and just last week, federal agencies identified pregnancy as being associated with a greater risk of poorer outcomes from COVID-19. And our research has shown that there's a higher propensity for preterm labor in pregnant women who have COVID-19. We're still learning about the effects of COVID-19 in childhood. As I'm sure we're all aware, overall, the incidence of the infection, the clinical incidence of the infection, seems to be lower in childhood, but we still have a lot more to learn about this disease. Finally, I want to say something about the structure of this symposium and the topics. I'm so pleased to see that we're going to hear a lot today about genomic advances in children's health and about cell and gene therapy, because these are such important and exciting frontiers and areas that we in Stanford Medicine have made significant advances in and investments in over the past 5 years, as well as carrying those investments and those therapeutic opportunities into our children's hospital and our children's health programs. So I'm pleased that we're going to be hearing updates today on those programs. I'm also pleased that we have a session devoted to the social and behavioral determinants of health. I view these as side by side, more than side by side, really connected. And that is, take the best advances in biomedicine and biomedical science today to treat and hopefully in the future predict and prevent severe acute diseases and be able to correct genetic diseases in ways that even 5 years ago we might not have imagined. Yes, we want to continue to advance on those frontiers. We also want to have impact on the social, environmental, and behavioral determinants of health that we know are so important in determining overall health outcomes. Congratulations to the organizers. Thank you for all the time and effort you've put into organizing this symposium. I look forward to it. And now it's my pleasure and honor to introduce Rick Magen, Vice President and Chief Operating Officer of Lucille Packard Children's Hospital and Stanford Children's Health. Rick?
Great, thank you so much, Lloyd. It is my privilege to speak to you all today on behalf of our wonderful hospital and health system. It is really a neat thing that we have embedded in everything we do research. And it is just our privilege to help to support the MCHRI, really working on the greatest health challenges facing moms and babies and kids, as Lloyd said, from stem cell to societal problems. I think we are looking equally important at advances in gene therapy and at health disparities. And it's become a wonderful way to help support our developing talent. And I think the discoveries that we bring here today will help to improve care throughout the world tomorrow. So I couldn't be more excited to help us support this work. We do view it as part of every leader's role, every clinician's role here, whether you're a front desk clerk that's helping a research patient in, or you're a physician doing amazing research in the lab. It really is just infused in our DNA here at Stanford. So I would like to take a second to just thank you all for making time for this activity today. I had a chance to look through some of the poster sessions yesterday. Amazing little mini talks and amazing variety of things that we're trying to help advance science on. With this, I'd like to introduce another important partner in this work is obviously the Lucille Children's Hospital Foundation, led by our CEO, Cynthia Brandt. Cynthia?
Thank you, Rick, and good morning, everyone. Yes, here at the Lucille Packard Foundation for Children's Health, we absolutely have shared purpose with everyone here today and with the MCHRI, all about helping moms and families through the highest caliber research. At the foundation, our mission is that we're here to unlock philanthropy, fundraising, to transform health for children and moms in our community and around the world. Now, philanthropy is often really critical for new discoveries. It provides funding to bring together all of you, to bring together the brightest minds, to tackle some of the hardest questions. That's been very true this year, even as our business of fundraising has certainly been affected. Our donors have stepped in and stepped up to continue supporting. In March, an anonymous donor funded a number of research studies related to the coronavirus, including one on household transmission, led by our very own, Packard's very own Dr. Bonnie Maldonado. So it's been really motivating for all of us at the foundation to work with Dean Lloyd Minor and with all of you and faculty across the school. Now, this summer at the foundation, we focused even more attention on racism and discrimination, and really talking about with our donors about how that stands directly in contrast to our vision and our mission of health for moms and kids. And every day we see the disparities in health outcomes. And that's something the foundation is really tackling in partnership with MCHRI to make a difference on. So for example, every year, more than 8,000 donors give to something called the Children's Fund. These are gifts of all sizes. And 1/3 of those funds from the Children's Fund come to MCHRI to support priorities here at the Institute. And we're especially proud that MCHRI is using some of those funds for new pilot grants for research on structural racism, social injustice, and health disparities in maternal and child health. So I want to thank and congratulate Dr. Mary Leonard and the whole team at MCHRI for taking on these most challenging topics and doing so in the very most rigorous way. So on behalf of the foundation, let me say thank you to all of you. We're very proud to work in partnership with you. And now I'll introduce Dr. Anthony Oro, who is co-director of the MCHRI and also leads the education committee that planned today's symposium. Thank you so much.